your warm introductions. Thank you, Family Guardian, Muhammad Health, friends, family, colleagues. I'm so excited to be here. As stated, I am Shanishka Cambridge. I am a registered dietitian, and it is so fitting that I have this opportunity to share with you in March, being National Nutrition Month, and also Kidney Awareness Month. So we will get started. My topic this evening is medical nutrition therapy for chronic kidney disease. At Oak Tree Medical Center, I have the opportunity to consult and participate in patient care for a wide array of patients, including those diagnosed with chronic kidney disease and end-stage renal disease. And so as I go through this presentation today, I want to let you know that in my practice, we often see persons who are experiencing these conditions, and prompt treatment, prompt care is always the way to go if we want to improve outcomes for these patients. So let us celebrate. The theme this month for National Nutrition Month is Beyond the Table, and the theme for National Kidney Awareness Month is Get to Know Your Kidneys. So this evening, I'm so happy to be able to share with you the latest clinical practice guidelines and evidence-based research that can guide us when we want to either improve our nutritional behaviors as persons who want to prevent chronic kidney disease, or if we have already been diagnosed with it, we can incorporate some of these strategies that help to manage our condition. And with the theme for National Nutrition Month, Beyond the Table just means that we want to think beyond the table. Sometimes we decide to eat, okay, I want some food. This tastes good. This is what I can afford. Okay, I ate, I'm full. But we don't think beyond the table. We don't think about what impact is that meal going to have on my health? What impact does that meal going to have on the environment? So we want to think beyond the table this month, and we want to get to know our kidneys. Did you know that approximately 90% of all persons who are diagnosed with kidney disease don't know they have it? This is startling. This is a statistic that was published by the National Kidney Foundation. And if you are unaware of this foundation, it is a professional organization based in the United States that publishes research regarding kidney care or in nephrology, as well as publishes clinical practice guidelines for practitioners. And the reality is that sometimes chronic kidney disease does not present with symptoms. And I see this often in clinical practice. Persons just happen to go to get an annual or something else, and there's something that shows up in their lab that has them referred to Oak Tree Medical Center to see the nephrologist, and then they become my patient as well, because most persons don't even know that they have this condition. So chronic kidney disease is termed by many as an under-recognized public health crisis. If you take an opportunity to search in Google, chronic kidney disease, public health emergency, public health crisis, you will begin to see numerous accounts around the world with public health organizations, private health organizations, just lamenting about the burden that chronic kidney disease is having on the healthcare system, and also impacting increased rates of disability and increased rates of early mortality. And this is happening because more than 10% of the worldwide population is affected by chronic kidney disease, and that is more than 800 million people. When you see the statistics, 10%, you may think, 10%, that's small. But when you think about the thousands and the millions of diseases around the world, 10% is a large number for one disease. And as a result, this is causing deaths of millions of people worldwide because they do not have access to affordable treatment, right? It's so sad. And in fact, chronic kidney disease causes more deaths than breast cancer and prostate cancer worldwide. But the good news, right? I love me some good news. The good news is that with early diagnosis and treatment, it is possible to slow or stop the progression of kidney disease. Okay, I'm gonna repeat that. With early diagnosis and treatment, it is possible to slow or stop the progression of kidney disease. Can I get it? Amen. All right, so let's begin some of this topic. So this evening, my hope is that at the end of this session, you will be able to understand the role of medical nutrition therapy in the management and treatment of chronic kidney disease. I want you to be able to also recall or remember at least two nutritional concerns or problems when managing and treating chronic kidney disease. And I want you to be able to recognize when a referral, right, for medical nutrition therapy is needed in the treatment and management of chronic kidney disease. So what are the kidneys? The kidneys are two organs that are being shaped, located in our body. And these are powerful organs. Sometimes we don't even realize just how important the kidneys are because they remove waste products and toxins from our blood and we excrete them in our urine. They help with aiding acid-base balance. They maintain a healthy balance of minerals in our blood, whether it be sodium, potassium, phosphorus, calcium. They help with balancing the fluids in our body, and they help with regulating blood pressure, as well as help with activating the type of vitamin D that we need for healthy bones. And last but not least, they are important for controlling the production of red blood cells. So we see here that if our kidneys begin to weaken, if our kidneys fail, it will have a significant impact on so many different functions in our body. So as a result, we will become more toxic, right? There'll be more toxins building up in our blood. We will become more acidic because the kidneys are not able to deal with excreting and balancing the excess acids as it did before. We may have overload of fluid retention, edema. Our blood pressure may become uncontrolled. It is high. Our bones may become weak. We may become anemic. There's so many different things. And in day to day, I see patients on a daily basis who are battling chronic kidney disease and end-stage renal disease because we have a dialysis center. And it is so disheartening sometimes just when you have to share with them how their nutritional habits are influencing the progress or the decline in their kidneys and what impact that is having on other diagnoses. And they just can't, they're just lost. They don't know what to say because nobody, or I'm gonna say nobody, sometimes we don't think about just how important the kidneys are. And I'm hoping that this month you are getting to know your kidneys just a little bit better. So what is chronic kidney disease? Chronic kidney disease is a gradual loss of kidney function over time. And if this loss continues, it can lead to end-stage renal failure. End-stage kidney renal failure is fatal, means it can lead to death if you are not treated promptly. And the treatments include at this time going on dialysis, which is an artificial means of filtering or cleansing your blood, or getting a kidney transplant. Now, you know, I ain't seen no store selling kidneys, right? And though we have two kidneys, sometimes it's hard to get somebody to give you one of theirs. And sometimes it's difficult even to qualify for the transplant because you have to have a certain level of health status in order for your surgery to be successful. And of course, kidney transplants are expensive. So we don't want to rely on kidney transplants. We don't rely on that dialysis machine because these things come with some negative effects. So when we think about chronic kidney disease, we can classify it in stages. So we see on the right-hand side, there are 5 stages. Stage 1 is considered normal function or mild dysfunction, depending on if there's protein in the urine. It may still be considered chronic kidney disease. Stage 2 is when there's mild kidney damage. Stage 3, mild to moderate kidney damage. Stage 4, severe kidney damage. And stage 5, this is the most severe kidney damage or kidney failure. And you see there is an abbreviation, EGFR, and that stands for estimated glomerular filtration rate. And what this means is this is an estimate of how well our kidneys functioning. And so I want you to write that down so you can go to your physician and you can say, I want to know what my GFR is. I want to know what stage am I at with my kidneys because I want to prevent or manage this condition much better. Here is just a little diagram showing the progression with some kidneys, just showing that how over time, as the kidney function begins to fail, we are entering kidney failure. So what are the symptoms of chronic kidney disease? If 90% of the persons don't know they have it, then some of the symptoms could be none. As I said, many people don't even know they have chronic kidney disease, but there are some symptoms that some may experience. They may include dry and itchy skin, which is in part due to the amount of toxins and waste products that are building up in the bloodstream. They may become tired or weak. Their urine may become bubbly or foamy. They may have swelling in their hands, their feet, or their ankles, puffy eyes, trouble sleeping, loss of appetite, muscle cramps. They may need to pee more often, or they may have a reduction in urination or even painful urination. And when you look at some of these symptoms, some of these we probably experience from time to time, and we don't think that, oh, do I have chronic kidney disease? You may not, as well as you may. So we see that symptoms for chronic kidney disease are very similar to other situations. So we want to know our status. So are you at risk? Am I at risk? What are the risk factors? Risk factors can include diabetes, hypertension, obesity, heart disease, a family history, ethnicity. For example, being Black, from African descent is also a risk factor. Older age, or some conditions like lupus or polycystic kidney disease, kidney stones, urinary tract infections. These are all risk factors of chronic kidney disease. So what can we do about it? How can we use medical nutrition therapy in the prevention and treatment of chronic kidney disease? Now, what is medical nutrition therapy? Some persons say, what's medical nutrition therapy? I have a definition here from the Centers for Medicare and Medicaid Services, and they say medical nutrition therapy services means the nutritional, diagnostic, therapeutic, and counseling services provided by a registered dietitian or nutrition professional who meets certain requirements. Now, they have to define this because if you know or you don't know, Medicaid provides public health insurance, and that insurance covers medical nutrition therapy for chronic kidney disease. And so they have to have a definition. So we see how this mode of patient care fits into the entire framework when we are taking care of patients who are diagnosed with chronic kidney disease. The dietitian conducts an assessment looking at body composition, looking at the labs, the medications, the blood pressure, the blood sugars, their diet, their diagnoses, and they come up with their particular nutritional diagnoses to plan an intervention that is aimed at slowing down the progression of chronic kidney disease or managing the symptoms of this disease. So does one shoe fit all? Well, no, I'm a 7.5. Your foot might be size 9. So we don't have the same size feet, and the same medical nutrition therapy cannot be applied to everybody. It is individualized. And to give you an idea, there are 3 patients here on the screen illustrated, and they are very different. So one patient is a 49-year-old female, one a 15-year-old male, one a 30-year-old male, different weight status, overweight, underweight, normal weight, different diagnoses. One has diabetes, one has lupus, one has polycystic kidney disease, one has hypertension, right? And different medications, different things going on in their labs. Whereas everybody may have a high creatinine, which is one of those markers that can indicate that your kidneys are ailing. Others may not have a high potassium or high phosphorus like patient A. Others may not have a high A1C, which is a measure of diabetes control. But some other person may have a high SAD rate, which is for inflammation, or some person may have a lot of oxalates in their urine. And so we see here that when persons present with chronic kidney disease as a registered dietitian, it is important not just to consider that, oh, kidneys are not doing well, but you have to consider what is their weight status? What are the reasons why they have chronic kidney disease? Because you have to also treat and manage the underlying conditions that is promoting it. Because if you don't treat those, then the kidney disease will continue to accelerate and your efforts with nutrition therapy will not be as effective. Also, you have to bear in mind the medications because they too impact what to eat, when to eat. It has an impact on the labs. And we need to take all of these in consideration in this type of care. So one size does not fit all. So what are some of the things that we can talk about when it comes to nutritional therapy for chronic kidney disease? We want to think about protein. Now, protein is a macronutrient. It means that we need it in larger amounts, and it helps with building tissue, building and maintaining muscle and bone and skin and our internal organs. There are also proteins in our blood. So it's very, very important. But how does this relate to our kidneys? Well, we can look at some practice guidelines from the National Kidney Foundation, and they can give us some information about what we need to know about protein management. Here on the screen, we see sources of protein. So there are animal sources of protein and there are plant sources of protein. And this is important in our conversation. So what are the guidelines? The guidelines are that it is recommended that protein be restricted in patients who have chronic kidney disease in stages 3 to 5, who's not on dialysis, provided that they are metabolically stable, with the goal to delay kidney failure and improve quality of life. So we see that a very important component of medical nutrition therapy in chronic kidney disease is we have to lower our intake of protein. So that means all that meat we like to eat, but so bigger than our hand, that's too much meat, you see? We need to bring that down, family. Bring it down, bring it down, bring it down, bring it down. Because as we increase our intake of protein, it increases the amount of toxins in our body. So when we reduce protein, we reduce what is called uremic toxins. When we reduce protein, we reduce what is called hyperfiltration, which means our kidneys working harder, sweating, pushing, pumping harder than it needs to. And when we reduce protein, it reduces the amount of acids in our blood. It reduces how much protein that we are spilling in our urine, that we're excreting and peeing out. And this is important because all of these things will help to slow down the progression of chronic kidney disease. And so here's a study that talks about why protein restriction is important. This is published in the Journal of Clinical Medicine. And they found that the benefits of protein restriction before dialysis is so important that it should be prescribed as a medication. We've heard the term food is medicine. Hippocrates is claimed to be the one to come up with that slogan. But this is so powerful in that nephrologists are saying that, hey, you know what? We don't just suggest that you reduce your protein if you're not on dialysis. We need to consider this as a medication. So they say nephrologists aligned with renal dietitians may approach the implementation of low protein diets similar to a drug prescription, considering its indications, its contraindications, its mechanism of action, the dosage needed, the unwanted side effects, and any special warnings. And this is a strong statement they had, and they say that we should not consider medical nutrition therapy as a lifestyle option. Let's improve our lifestyle, child. Not eating better. I try and improve my lifestyle. No, it has to be viewed as a core element in management of chronic kidney disease because it is effective and it does delay the start of dialysis and has additional benefits beyond restricting the protein alone. Strong statements coming from the research. So how do we choose our protein? Remember now, we have plant protein, and we have animal protein. So the plant proteins are things like the beans and the nuts and the seeds and the tofu. And animal protein, like your meat, your chicken, your fish, your seafood, and other things like that. And there's research to show that, hey, guess what? Quality of protein matters. So it's not just the amount of protein that you eat, but where is it coming from? And the research is clear. This research looked at persons who were followed for 6 years. There were 1,639 adults. And they found that this study confirmed an inverse association between plant protein intake and the risk of incident chronic kidney disease, demonstrating that plant protein can protect the kidneys, right? So what does this mean? It means that as they increase the plant protein and reduce animal protein, persons were developing chronic kidney disease at a lower rate. And one of the reasons is because it produces less waste in the blood, and that is helpful for the kidneys. They actually found that 70% decreased incident risk of chronic kidney disease occurred in this particular study, published in the journal BMC Nephrology 2020. Phosphorus. Phosphorus is another nutrient of concern in chronic kidney disease in medical nutrition therapy, and the guideline says you recommend adjusting phosphorus intake to maintain the blood levels of phosphorus or phosphate in the normal range. So there's no specific number for phosphorus. Yes, we have guidelines that we use as dietitians. However, we have to monitor the labs. And so we have to follow the patient. We have to continue to provide care so that we can identify where is the phosphorus coming from? How do we increase, decrease to keep the levels where they need to be? And why is this important? Because high phosphorus can cause brittle bones, calcification in the eyes, the lungs, and the heart, and it increases the risk of heart attack, stroke, and mortality. And so phosphorus control is crucial. Here's another research. We know that it's not just looking at what has phosphorus, but where is it coming from? Is this phosphorus naturally occurring in food, or is this phosphorus that's been added to food? So many processed foods have added phosphorus or phosphates. And we see in this particular food label, you want to be looking at the ingredients. Is there PHOS in that food? Those foods will have a higher absorption of phosphorus. And the research shows that consuming added phosphorus is associated with a more rapid decline in kidney function. So naturally occurring phosphorus would be in the foods that are minimally processed. They are found in the protein foods, whether it be plant protein or animal protein, as well as dairy products, beans and whole grains. But the processed foods that has the added phosphorus in your processed meats, in your processed grain products, your processed cereals and your waffles and your pancakes, the added phosphorus and those absorb more rapidly, and they have a faster impact on declining kidney function. So working with a registered dietitian, nutritionist can help you with quantifying quantity of phosphorus and adjusting types of food with phosphorus to help to keep your levels intact. Sodium, we know sodium got to go down, 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 right? We recommend limiting sodium intake to reduce blood pressure, reduce protein in the urine, and avoiding fluid overload or fluid retention. And this is so important because higher blood pressure means faster decline in kidney function, and more sodium or salt that we consume means more protein that we're going to urinate out. The more protein we urinate out, the faster we are heading to the dialysis center. So we want to restrict our sodium intake. And this research showed that when persons restricted their sodium intake, blood pressure went down, the amount of protein in their urine also went down, and this is important in the management of chronic kidney disease. We can read our labels to help us to choose foods that are lower in sodium. So we can look at the nutrition facts. We check out our serving size to see how much of the food is the serving size. Are we eating more than the serving size or less? The serving size is related to the numbers. So if we ate, for example, in this particular macaroni and cheese, which you should not eat, right? If you are really plagued with chronic kidney disease, because it's going to be high in phosphorus, high in potassium, high in sodium, and not going to be helpful. So we want to know, am I eating more or less? Because I'm eating more than the serving size, and I'm eating more of what is here. So if I eat 2 cups of this particular food, I'm eating twice as much of everything here. So looking at the sodium, we would find that if a food has the percentage in the purple section, you see 20%. If that percentage is 5 or less, it's low in sodium, but if it's 20% or more, it is high in sodium. We can reduce our sodium by choosing other kinds of seasonings that naturally do not contain salt, like herbs and spices, but we want to be careful with things that are salt-free because sometimes it has something added called potassium, which may not be beneficial, which leads to our next slide, potassium and chronic kidney disease. So potassium needs to be adjusted like phosphorus so we can maintain the levels of potassium in the blood. Potassium is important. We need it for blood pressure control. We need it also for proper heart function. But if we have chronic kidney disease, our levels might go up when the kidneys get weaker. And if they go up, that can cause chest pain, heart palpitations, irregular heartbeat, numbness. But guess what? If our levels get too low, it can also cause heart palpitation, muscle weakness, and tingling. So we see that high potassium and low potassium are not good. We want to be getting enough potassium so that we can avoid these particular issues, and it also helps with regulating our blood pressure. But again, like the phosphorus, the added potassium in the food is associated with some issues. And so we want to be looking at the ingredients to see, does the ingredients have the word potassium in it? Because we want to be minimizing those foods and choosing foods that are lower in potassium, like we see here, broccoli and cabbage and berries and apples and oatmeal and hummus and tofu and sweet almond milk. And we want to manage how much higher potassium foods we're consuming, like potatoes and tomatoes, banana, cantaloupe, granola, bran cereal, meat, poultry, fish, beans, nuts, and dairy milk. So we see here on the right-hand side that protein sources of food are naturally higher in potassium. And so with the protein restriction, we're also going to be lowering our potassium intake. And this is important for managing our kidneys. What is your proud? Acid is something else that we have to briefly mention when we're talking about chronic kidney disease, because when we consume foods that are producing too much acid, it does accelerate kidney decline. And the kidneys are responsible for acid-base balance. So acidosis, meaning too much acid, can lead to worsening of our kidney disease, bone loss, muscle loss, wasting, poor blood sugar control, endocrine problems. So we're dealing with things like thyroid and pancreas, hyperkalemia, which means high potassium in the blood. So we want to be knowing that, hey, what is higher in brown? Meat, poultry, fish, eggs, and cheese. And what is lower in brown? Fruits and vegetables, herbs and spices. But remembering that fruits, vegetables, herbs, and spices contain potassium as well, it's important to work with the registered dietitian nutritionist to help you to identify quantities and types of foods to help with your acid-base balance. This study showed that when persons consume foods that are higher in protein, meaning higher in producing of acid, it was associated with worse kidney function after 1 year. And how worse? After 1 year, it was a 10% decline in GFR and a 10% increase in the amount of protein in their urine. And this is just 1 year. So imagine if it was 5 years, how much worse the kidneys are getting just because of too much acid. So by now we should know that nutrition is important. And so the last nutritional item we will talk about today is fiber. Don't forget the fiber. We won't spend much time here because we have seen how the plant foods are helpful with slowing down the progression of chronic kidney disease, and also because they have fiber. And the fiber does something marvelous. And one of the things that it does is that it affects how the composition of the good and bad bacteria in our intestines. Did you know that you have bacteria in your body? That's true. Yes, you and me. We have bacteria in our body. Some are good, some are bad. And if we have too much of the bad bacteria, that produces more toxins, and more toxins that the kidneys have to eliminate. So our kidneys are weak. It is challenged with this. And the research shows that if we increase our fiber intake in a smart way, this can reduce those toxins. It can preserve kidney function. It can slow down the progression of chronic kidney disease through different mechanisms, whether it's metabolisms, our immune system, or reducing inflammation. So we need help. And when do we need to refer for this medical nutrition therapy? If you got chronic kidney disease or your kidneys have failed, we need a referral right now. If you are not seeing a dietitian nutritionist, you need to get on it, speak to your physician. We need a referral because we need to get us some help. So when do we refer? And this is beneficial for you as the patient as well as for healthcare providers. The Center for Medicare and Medicaid, who provides coverage in public health insurance for chronic kidney disease, MNT, says when to provide MNT, a diagnosis, right? And so they recommend that when you're providing a first referral for medical nutrition therapy, you should refer for 3 hours, right? For 3 hours for that first year. And then after that, for the follow-up years, at least 2 hours per year. That is what they're covering in their public health insurance. And they're saying, guess what? If there's a medical necessity for more medical nutrition therapy, you should refer again. And how do they determine medical necessity? They say if there's a change in medical condition, so this could mean maybe the kidney function change. We went from stage 3 to stage 4. That's a change. Perhaps they have a new diagnosis. Now they have hyperkalemia, high potassium, phosphatemia, high phosphorus, or something else. Maybe their medications change, and that needs to change the medical nutrition therapy. Whatever the medical necessity is, Medicaid says you can refer again for more medical nutrition therapy. And so for our practitioners who are maybe listening, the dietitians and nutritionists, the National Kidney Foundation Clinical Practice Guidelines said that we should be routinely providing nutrition screening. How often? At least twice per year to help identify persons who may be at risk for protein energy wasting. This is malnutrition, which is common in this type of disease. So we might want to be doing this at least twice per year. And in terms of a more comprehensive assessment, you want to be doing that at least annually or within the first 90 days on dialysis, or when there is a need due to the referral or the findings from the screening. And don't forget, We have to look at our appetite and the dietary intake, the weight and the labs and the body composition and the physical findings. Do we see edema? Do we see changes in skin? How is the taste? All these things are important in medical nutrition therapy. This has been great. This has been fun. And my last message is that the recommendation is that a registered dietitian, nutritionist, or international equivalent in close collaboration with their physician should provide medical nutrition therapy. And the goal is to optimize nutritional status, minimize risks imposed by comorbid conditions and alterations in metabolism so that we can slow down the progression of kidney disease and we can slow down adverse clinical outcomes. Here are my references. It has been a pleasure presenting this topic to you today. Chronic kidney disease and stage renal failure is an epidemic. It is a pandemic and it is taking out our loved ones, and we want to save our kidneys, right? Let's save our kidneys one bite at a time. Thank you for your attention.
Ms. Cambridge, that has been such an enlightening presentation. And it's funny that you say we'll save our kidneys one bite at a time, because we know here in the Bahamas, end-stage kidney disease is very, very, very prevalent. It's almost, I want to say it's almost as common as persons having hypertension or diabetes. And in your presentation, you would have given us so many little nuggets along the way, and we were getting questions in the chat. So now we're going to go into our question and answer session, facilitated by yours truly, Nurse Shanishka Cambridge. And so one of the questions that I got in the chat was, can we talk a bit about protein powders, right? We have persons, guys, and I want to say guys, who, mainly go to the gym. They want to beef up. They want to get all of that muscle. And, they use these supplements, protein powders. Is there any negative impact of using protein powders on the body?
Thank you for that question. So as we were discussing chronic kidney disease, you would have seen that when a person's kidneys are declining in function and they are not on dialysis, it is very important to restrict or lower the protein intake, because higher levels of protein produces more waste product in the blood, and this accelerates the progression of chronic kidney disease, leading to kidney failure. For bodybuilders, we know that they love them up some protein, right? But one of the things that I know, being a retired triathlete, is that when it comes to muscle building, what is important is that though we're going to be increasing protein intake, we also need to increase our calories, and we also need to do the weight resisting exercises. Because if you go to the food store and just buy protein supplements and you don't lift weights, you will not gain muscle, right? You probably get fatter or gain more fat, because the protein will convert into fat. And so the main thing with building muscle is lifting the weights. And so there is some research to show that an overconsumption of protein powders can harm kidney function. It can accelerate kidney decline. And so you want to get some advice on quantity of protein needed, even for a person wanting to build muscle, so you don't go over your intake of protein, because we want to preserve our kidneys. So I would not recommend protein supplements just for everybody and anybody. It really just depends, and the quantity of protein is what matters. Just last week, I had a patient who, they were adamant, I want to take my protein supplement. I gotta do this, and they believe that's what they needed to do. And so what I had to do is I had to assess, how much protein do you need, and can I see the protein product? I read the label, I looked at the quantity of protein, and I included that into the whole day, so to ensure that they were getting the amount of protein they needed to support their exercise program, but it wasn't in excess, so that it wouldn't lead to some further decline in kidney function in the future.
Okay, thank you. So let's talk a bit about, let's say we don't want to use the protein supplements. We want to go the natural route, right? Bite, like you say, by every bite. So What types of meat you would say, or is it mainly more of the red meats, would you say has a greater impact or increases your protein intake the most?
Okay, so you're asking me about quality of protein, types of protein. So as I answer this question, I want to be clear as to what I'm responding to. So if you are a person who has already been diagnosed with chronic kidney disease,
Mhm.
right? The research is clear. The more red meat and processed meats that you consume, it will accelerate decline in kidney function. So if you want to prevent dialysis, one of the things you must consider is whether or not you're going to avoid eating red meat and processed meat, or you're going to reduce your intake of that and bring it down to the level that is appropriate to keep your kidneys in preserving of its function as long as possible. Now, I will say though that the World Health Organization has made it clear that processed meats are a group 1A carcinogen. What does that mean? That means that our corned beef, our hot dog, our salami and sausage, the research is clear. We know it causes and increases the risk of cancer. And so not only do we want to reduce processed meats and reduce red meat, which is group 2 carcinogens, we want to reduce them also to lower our cancer risk. And so I would say avoiding red meat and processed meats are most beneficial. If you want to consume animal protein, we have like fish, chicken, and turkey. Those ones would have less of an impact, but balance and variety is important. So I'm always encouraging persons to eat more plant protein. You're gonna get so much additional health benefits. So you want to balance our intake of protein, and MNT can help you to discover how to do that.
Thank you. So the questions are just rolling in. So we'll continue on with those. So the question reads, do you recommend cleansing the kidneys? Now, I don't necessarily know if the question wasn't specific to say if this was someone that is already diagnosed with kidney disease. This can be a person who is just health conscious. Do you recommend cleansing the kidneys? And if so, how can one cleanse their kidneys?
Wonderful question. The topic of detoxification is, as you know, all over the place, right? We want to talk about cleansing all the time. I'm going to detox. I'm going to cleanse. Daniel fast. Any Daniel fast persons in the house, put in the chat. Put in the chat. Put in the chat. Right. We want to remember that the kidneys naturally is a detoxification organ, right? And so it's designed to remove waste and toxins and drugs from the body. To support kidney function, if you do not have chronic kidney disease, one of the main things you want to do is drink more water, right? Drinking more water and reducing sugary beverages, cleaning up your diet, so we're reducing processed foods and other food additives will naturally help to cleanse your kidneys, cleanse your blood, eating more fiber, eating 30 grams of fiber a day from real foods, whether it be fruits or vegetables, whole grains, beans, nuts, or seeds. All of these things will help with cleansing of the blood because we are assisting the removal of toxins from the body. I do not recommend that person go and buy a particular supplement, a detox supplement off the market because, as a health professional license, I can't do that, right? But what I could say is that if we improve our eating lifestyle, drink more fluids, clean the diet, eat more plant-based foods, that will help with so-called detoxification of the kidneys.
Right. Everybody, and especially at the beginning of the year, everybody want, detox, detox, detox from all the damage that they would have done. So that brings me into my next question. One of the things that you talked about is the nutritional medical management. Hope I'm saying that correctly. This is a fairly new concept of me hearing, and I can't speak about ours, but I know it's new for me. Do you find that what is the response been like in the Bahamas? Is it more or less you find that people are utilizing this type of service after they've been diagnosed with a chronic disease such as end-stage renal disease or maybe diabetes, or you find that persons are actually taking advantage of this benefit more or less on the lines of a preventative benefit?
Okay, thank you, Lord. And I made some notes to make sure that I can touch on them. Okay, so it is medical nutrition therapy. So medical nutrition therapy Many persons in the Bahamas are not familiar with that term, and that's why I'm so happy to have this opportunity to introduce that. But it is known, in healthcare in the Western world. You can type it in. Medical nutrition therapy is a modality covered by dietitians and other persons in the field who may not be registered dietitian, but may licensed dietitian depending on their country. And it is covered by insurance in the Western world, right?
Right.
So in terms of usage of it, because we have a low awareness of what MNT is, and I'll abbreviate it, our access to it is not where it should be. The Bahamas is leading in rates of overweight and obesity and diabetes, breast cancer in this part of the world. And nutritional behaviors does impact the outcomes of those conditions on kidney disease as well. So there could be a increased access to care. And that's why I wanted to include in my presentation, knowing, okay, not just what is medical nutrition therapy, but when do you refer? How often is it needed? Who is the practitioner who is qualified to provide this service? Because we don't access it for prevention. We're accessing it because we about in this conversation end up going on dialysis. Okay, I saw a patient today. I look back next week, they're on dialysis. That's too late, right? They need to have been referred from the minute that there was an indication that their kidney function was declining. So we don't utilize services of nutrition for prevention as much as we should in the Bahamas. We want to wait for the last minute, and then we don't have much confidence that it will have a positive impact. And that's why you've seen I was heavy on the research, right? I love me some research because I want persons to see it's not just my opinion, it's not just what I think I should talk about, but this is known, it's factual, it's scientific. And if we are not on it, we need to get on it. Like today, Oak Tree Medical Center, MNT, what's up?
I saw that plug. I hear you. So luckily for Bahama Health members, we do have this benefit. It's a one-time benefit. Unfortunately, I am guilty as charged of not utilizing this benefit. So certainly once a year, I know that I'll be tapping into this. But more so, I want to inquire, do you have a specific programs for specific diagnosis? So just say I am diabetes. You have a specific plan to address diabetes, or I am hypertension, or I am obese. Do you have a myriad of plans that can address, a wide span of diagnosis?
Yeah, so in my bio, I would have included that one of my career goals is with quality improvement in medical nutrition therapy protocols, which is like a program. And so at this time, we will be launching some group programs. Currently, the programs for diabetes prevention. So these are persons who refer to myself who may be pre-diabetic. Maybe their A1C is not high enough to be diagnosed as having type 2 diabetes, but they want to prevent that. They don't want to go on medication, and so they're referred. So there is a protocol, a program that I implement for diabetes prevention. If you already have been diagnosed with diabetes, whether it be type 2 or type 1, there's a protocol, a program that one can go through with self-management of those conditions. Same thing with the kidneys. I like to call it the Kidney Hope Nutrition Program, because we want to have some hope that we can preserve this kidney function. But what I find is that there is sometimes not, persons sometimes don't see the need to continue to invest. The reason why a lot of persons are dying from chronic kidney disease is because they say they can't afford the treatment. And so government of Bahamas, Prime Minister, Minister of Health, if you're listening to this, send a link to our Prime Minister, send a link to our Minister of Health. Guess what? We need to get this on NHI, because in the Western world, if you have a universal health insurance, you can see the dietitian with that insurance. And so we want to be including covering of medical nutrition therapy by insurance, public and private, so that we can help our people, right? And so the programs are there, the persons are ready. We just need to work together. So yeah, this there, and more is coming. Thank you.
Ms. Cambridge, you have people asking you for prices, for quotes for people persons who do not have insurance. So I think definitely you need to drop your contacts in the chat for you to give them some additional information.
Okay, so
Okay.
all right, cool.
And if there are no other questions in the chat, I have my final question. I just want to take you, Miss Cambridge, to the grocery store with me, visually in my mind. Help me as a Bahamian on a Sunday with my good old peas and rice, my macaroni and my potato salad. Help me to swap out some of my ingredients for my most popular Bahamian dishes on a Sunday that I could use to decrease my caloric intake and also spare my kidney some unnecessary protein and sodium.
Okay, I'm happy to answer that question, but I saw a question pop up in the chat and I will answer that. It said, do you need a referral? So at this time, you can come to Oak Tree and see me without a referral. Everything that we need to investigate, we can do. So we need to run labs, we can do that too. So you don't have to have a referral to see me. You just need to present. So I'm located on East Street location and they will continue to share my contact. So in terms of going to the grocery store with you, Mama, we love us some peas and rice, macaroni, salad, coleslaw, all the race. Getting me hungry. But guess what? If we want to improve our plate, the first thing we have to do is understand what are the food groups, right? So a simpler way is thinking about, okay, what is starch? What are the lower starch vegetables? And what is protein in that meal? So think about it. Peas and rice, starch. Macaroni, starch. Potato salad, starch. We have 3 starches. So we know that we need to decrease the amount of that on the plate, maybe a quarter of the plate. Rather than having the coleslaw with all the mayonnaise, maybe we can swap the coleslaw up with some iceberg, lettuce, and some carrots and a little bit of tomatoes and make that most of half of the plate, right? So we have our peas and rice, maybe have a little bit less of the potato salad to make the fit in that little quarter of the plate. We have our salad and we reduce the size of the meat. You know, patients tell me they put the meat on top of the rice. So the rice all over the plate, right? They may not have all the macaroni and potato salad and coleslaw like you, right? Maybe they just working on a different kind of budget. You know, Bahamas must he pay you real good, real good. So maybe when they go to the store, they're getting the rice and the meat. So they make the rice all over the plate. Bang! And they slap that meat on top. Whap! No, mama, no, papa. We want to reduce that rice about quarter of the plate. Use some of that money that we was going to spend on that rice and get some iceberg lettuce, even if that's the only thing for the vegetable. And then we're going to make our protein just a little bit smaller, much smaller, a quarter plate smaller than your palm, smaller, right? And then that can help with those things that you mentioned. But of course, that was just generalized. As you know, medical nutrition therapy is individualized to the person based upon your height, your weight, your age, your diagnosis, your medications, your labs. And so if you really have a serious health concern and you want help and you want food to be utilized also as medicine, as the research has said, come and see the dietitian, Oak Tree Medical Center. Let's save our kidneys one bite at a time. We can do this. There's hope for the kidneys. We need to take care of them. Thank you so much for having me.